So we're talking now about signs of disease, and specifically I'm giving signs, things that you can observe with your own eyes, right? Externally on your body, rather than having to go and get tests, blood tests, whatever tests, x-rays and so on and so forth, right? These signs also, I'm generalizing, there are normal variations in people depending on genes, race and so on and so forth. So I know some things might be different for somebody, but that's just their normal, right? So just kind of take everything overall and not necessarily too literally. And as always, when in doubt, seek your own personal healthcare provider for advice related to your specific situation. I'm not giving medical advice, right? All right, let's dive into the 7 signs of disease, potential disease, I should say. Okay, number 1, swollen ankles. So the ankles, we're not supposed to have like swelling of our body. And when I say swollen ankles, I don't mean mine. I mean like the ankles are swollen to the point where you can hardly see the 2 ankle bones on each side. That's not normal. That's an indication that for whatever reason, the body's not regulating the output of extra fluid or salt in the body as efficiently as it should, right? So if you find, and sometimes in the morning everything is fine, and then as the day progresses the ankles get more and more swollen. If sometimes people have an injury, like you damage your ankle, break the ankle or whatever, and then it's never the same after that, you continue to have chronic swelling of that damaged ankle. I'm not talking about that. I'm talking about bilateral, like both ankles being increasingly swollen as the day progresses. That's one sign of potentially things not being too right in the body, right? The second sign is something we call acanthosis nigricans. Basically, darkening of the skin, especially behind the neck, but it can also be to the underarm areas. It's like a darkening and a velvety appearance. It looks like velvet, thickening, darkening, and you might see like some cracks in the skin. We call that acanthosis nigricans, and basically it is an indication that there is insulin resistance in the body, which is a situation where, because of chronically or persistingly high blood glucose levels, the body has to chronically, or persistingly produce high levels of insulin to really get those blood glucose levels back to normal. And the insulin itself, because it's like an anabolic or pro-growth hormone, among the things that it stimulates growth of would be the skin cells. So there's like hypertrophy, like overgrowth of the skin, and also darkening. So the pigment cells, melanocytes, just overwork, and so you have this excess, the thickening of the skin with that velvety appearance. And you can have that in children as well. Children just going into puberty, just overweight children, you can have this as well. And seeing that is an indication of insulin resistance, and you need to look at the possibility. Okay, could you already have prediabetes? Could you be type 2 diabetic? But you can even not have those conditions and still have insulin resistance. And so if you see that things are awry with your metabolism, and you definitely need to seek medical advice about how to get that reversed, okay? 3, bleeding gums. That is not normal. Your gums are not supposed to bleed when you are brushing your teeth, okay? Or even when you're flossing, unless you accidentally slipped and literally cut your gum, right? So if your gums are bleeding, that is a sign that you have some amount of gum disease, inflammation of your gums, overgrowth of bacteria. And if your gums are not healthy, your body's not healthy, because that just promotes just general systemic inflammation in the body. So bleeding gums is definitely one of those signs of dis-ease or things not being totally right, in your body health-wise, right? 4th sign of possible disease is your hair falling out. Now, I'm not talking about just breaking, or maybe sometimes there's over processing of the hair, so the hair breaks. I'm not talking about that. I'm talking about your hair, strands and strands of hair falling out. And one way that you will notice this is that, you lie on the pillow, and then when you get up, there are tons of strands of hair stuck to your pillow. That is not normal, right? Now, we see that sometimes with an acute illness, like someone who has a bad case of pneumonia and they're down for a couple weeks with pneumonia. That can cause their hair to fall out, right? And that can be so devastating. I remember having a patient, she had an infection in her blood. She just kind of came down sick suddenly, and then her hair, she was so proud of her nice, thick, long, healthy looking hair. And so when she got pneumonia, I think it was some kind of illness, and her hair started falling out, she was crying, devastating, right? So when your hair is falling out like strands and strands of hair, that is another sign that something isn't right. Now, a lot of times, if it's an acute illness, after you recover from that, like after you recover from the pneumonia or whatever serious illness, or sometimes a heart attack, whatever serious illness you recover from, then that your hair follicles recover, and then you can grow back your hair and don't have this excess loss of hair, right? Number 5 is another sign, and again, I'm doing signs because things that you can like look at or just kind of check for yourself. If your waist, the circumference of your waist is as large as your hips or larger than your hips, that is not normal. So having a large waist compared to your hips is an indication that you have excess fat around the organs of the abdomen. So in the abdomen, we call this visceral fat. And also you may at the same time have excess fat in your liver as well, fatty liver. So if you see that you take a measurement, like you take a tape measure or string and measure it, and the length for your waist and also around your hips is similar, or even if the waist is more, then things are not good metabolically, and you need to start looking and reevaluating how you are eating and the types of foods and so on, so you can get that waist circumference down and overall improve your metabolism, right? Number 6, another sign of potential disease is rashes on the skin. Now, one rash that really like stands out to me is like having a rash on your face, especially in the region of the eyebrows, in the creases of the nose, and then for men in the areas where the hair bearing areas, right? So wherever they have their beard, they're like rashes and like pale skin. Sometimes it's like a thick sort of oily flakes in these areas, right? Or just like I said, loss of the pigment. So these areas just get pinkish or even whitish, right? That is also not normal. A lot of times it has to do with overgrowth of a certain type of skin fungus, right? And so things are sort of off with the body, and oftentimes the metabolism, and maybe it's even something that it might be an indication of you're getting you're diabetic, maybe, right? So rash there, that's one that stands out. Otherwise, if you have rashes in the creases, the body creases, so for women under the breasts, or for anyone under the arms and in the groin creases, if those areas are always kind of rashy, like rashes, moisture, cracking, sort of sore skin, that is not normal, and you need to look and see, hey, what's going on in your body systemically, right? And the 7th one is another sign of just maybe this potential disease, is having cracked corners of the mouth. The corners of the mouth are cracked and sore. That isn't normal. Now, is it that there's like a chronic yeast infection? Sometimes yeast infection is not necessarily of the skin or in the mouth, but it's just there at the corners of the mouth, right? Sometimes it's nutrient deficiencies can cause that as well. So, but whatever it is, if the corners of sometimes medications too, if the corners of your mouth are always cracked and sore, that is not normal, and it's a potential indication of disease. And by extension, I guess this can be a sort of bonus if your mouth is always dry to the point where your tongue is just chronically with a white coating, right? Then that's not normal, right? By extension in the mouth as well, if you have like white patches scattered around your mouth, or even ulcerations, even if shallow ulcerations, that is not normal. So those are the 7 signs of potential disease. And just to go over them quickly: swollen ankles, thickening, velvety, dark appearance, especially at the back of the neck; 3, bleeding gums; 4, hair falling out; 5, your waist is as large as or larger than your hip circumference; 6, rashes on the skin, especially the face and in the body creases; and then 7, cracked, sore corners of the mouth. Any of these present, then you need to consider strongly seeing your medical provider to look now more internally and look for actual symptoms, that may be there along with these signs that you may be overlooking. I hope you found this helpful. There's another video I did, which was 5 signs of health. You can go to that one as well. And any questions, let me know in the comments. If you found this video helpful, share it, and you can subscribe to my YouTube channel for more good information. Have a good day. Thanks for watching.